Hello, ma'am. So today I'm going to have the cephalocaudal assessment. So first thing to do is to prepare the necessary equipment that I'm going to use for having the assessment for today. I already prepare my equipment so that I easily get those equipment that I'm going to use to have the exam. And the second one is to introduce myself and identify the patient. So, hello sir, may buntag naman sir, ako na yung student nurse, Romero Albano. Sa yung ngalan natin, Elmar, o sa apelido. Dito edad? 11. Thank you. So, the next is to prepare the patient and environment. So, the first thing to do is to explain the procedure that how you will going to examine the patient. So, karon sir, akong i-examine imong ulo, lawas, ug tiil, kung nabe abnormalities. Okay? Okay, so, and the next one is to should have the room quiet and warm so that the patient will be having a condition to stay on the room. And the next one is to ensure the privacy of the patient. I already closed the window indoors to minimize the embarrassment to the patient, and also position to the patient should appropriately so that I can touch those parts that I'm going to examine. The next one is to obtain a health history if there is. So wala na ba ka na ato hospital sir na gi-confine ka na sakit? Wala. Okay, thank you. And also perform a hand washing for you to don't spreading a virus or okay. And now performing a hand washing. And the next one is to check the vital sign of the patient. So the first thing to check is the blood pressure to the patient. When I'm checking the blood pressure to the patient is normal. The next one is to check the temperature to the patient and also the respiratory rate to the patient. Before that, you're going to use the temperature. Clean before you use it to dirty to 30s. Okay. when I checking the temperature to the patient is normal, and also the respiratory rate to the patient is also normal. The next one is to check the heart rate to the patient. Okay. Okay. So when I'm checking the heart rate is also normal. Now, let us calculate the BMI to the patient. Let us get the height of the patient and the weight of the patient. Now let us examine the head and face to the patient. So first thing to examine is the skull of the patient. Okay. The first thing to examine the skull is to inspect the shape, the size, and the shape, size, and the symmetry of the skull of the patient. Okay, so the next one is to palpate the skull of the patient. So first thing to palpate is the contour, the muscles, and the depression of the patient. Okay. When I inspect and palpate the skull is normal. The next one is to the hair of the patient, to inspect the color, the presence of parasites, and also the distribution of the hair. What are the colors in box, right? Right. And palpate the thickness and thinness, textures, and oilness. Okay. The hair, for examine the hair is a normal. The next to examine is the scalp to the patient. So, inspection, the color, the oilness, presence of scars, and dandruff. Okay, normal, and palpate the lesion and muscle tenderness. Dili arbalaba di mo olor. Okay. When I'm examining the scalp to the patient is normal. So the next is to examine the forehead of the patient. So inspection, the symmetry, the skin appearance, presence of scars, and pimples. And palpate the masses, lump, and tenderness. Okay, normal. The next was to inspect the face of my patient to examine. So the first thing is to inspection the shape, the symmetry, presence of scars, pimple, or acne. Sir, tanaw na ako, sir. Yes, sir. And palpate the any swelling, lump, and masses. Tanaw lang na ako. Okay, normal. And now to examine the eye, just to check or inspection the symmetry. normal. For the next is to check, examine the eyebrows, to inspection the hair distribution, hair alignment, and any voluntary movement. Then palpate the presence of lump, the pain and nodule for the eyebrows. Normal. The next to examine is the eyelashes to my patients. So, inspection, the illness, distribution, and the color direction. Okay. So, when I'm inspecting the eyelashes, it is normal. The next is to examine the sclera eye of the patient. So at this time is to check the color, moistures, the textures, and the presence of lesion. Tanaw na po, sir. Tanaw na. Tanaw na. Tanaw sa baba. Okay, thank you. So it's also normal. The next is to examine the conjunctiva of the patient. So at this time is to palpate the lesion, the color, swelling, and the moistures, and also palpate the presence of pain on the conjunctiva of patient. Tanaw na ko, sir. Tanaw na ko, sir. Dili ba sakit ng mata, sir? Dili. When I'm inspecting the conjunctiva of my patient, the result was normal. The next to examine is the cornea of the patient. So this time is to inspection the textures and moistures, the cornea of the patient. Ano? Okay, thank you. The next to examine is the iris of the patient. So inspection, the appearance, coloration, and the shape, iris to the patient. Okay, normal. The next to examine is the pupil to the patient. So inspection, the color, the shape, and the equality of the pupils. Makaklaro o makaglayot? Maklaro. Thank you. So, when I'm inspecting the pupils of the patient, it's also normal. The next to examine is the nose of my patient. So at this time is to inspection the external bleeding, inflammation, swelling, and symmetry, and also inspect the sense of smell. Makasimho pero baka sir. Then also palpate the presence of pain and the tenderness. Dili wala may sakit yung ilong. Dili na sakit. Okay. When I examine the nose, it is normal. Now is to examine the mouth and lips. To inspection the color, textures, and the hydration. Okay, normal. Then at this time is to palpate the presence of pain and the tenderness. Okay, thank you. So it is also normal. The next to examine is the gums. So, inspection, the color, textures, bleeding, and retraction of the teeth. So,
May kaligo.
then palpate the presence of pain and tenderness.
May kaligo.
Okay, normal. So the next to examine is the teeth. So at this time, to inspection the discoloration, number of tooths, then textures.
Laba ka? Namatay ko din.
Namatay na yun ha.
Namatay? Parang yung balik.
Okay. For examining the teeth is normal also. Now is to examine the tongue. So inspection, the color, shape, surface characteristic, the symmetry, and also inspect of sense of taste.
Doon ng interior, doon nilapit. Ang kalit, doon nilapit.
Okay, normal.
Iba ba yung bliss?
Naro ba kayo mapansin?
Muna ang blade, muna.
Sense?
Muna.
Okay,
Ang
thank
ito, may
you.
kalit.
Then, inspect also the any pain and tenderness or any nodules.
Ang freedom si walang gapon. Walang gapon? Di ba pahalapan
Thank you. So, it's normal. Then the next is to examine the ears. So, at this time, to inspection the color, the shape, the symmetry
Asa nakita yung
of
mga
the
bagong
ears.
hospital sana?
And also inspection the inflammation or lesion of the ears.
Dito sa kuwan, kabili na.
Makabili na, kaya nahuman?
Ano man ang private muna. Doon nila ni.
Yung aid? Bago ba na, bakit mo tayo yung aid karon?
Liman ka na.
Then inspect for a presence of pain, then tenderness. Wala din ba sakit ang donggan? Okay. So then at this time, let's conduct a test in which the tuning fork test and also the voice whisper test. Okay, sir. Voice whisper test, sir, ha?
Go
Kung
mo kayo.
may mo i-iwan. Hello.
Hello.
Hello ba, sir?
Ang kagawin.
Hello. Okay, thank you.
May kwarto gawin ba ang butang.
Hi.
Iyon ako, sir.
Okay, thank you. So, the next one, the test is the tuning fork test, in which there are two types of tuning fork tests, the Weber test and the Binet test. So, first time is to have the Weber test.
Amin ay kung nagpa-doktor ni Boy nga tungod ospital di mo nga.
Hindi po sa mag-out, pagalian.
Ha?
Hindi pa sa
The
pagalian.
next one is the Deremy test.
Sige mo suka, God.
Ito man na.
Tukar mo po nung yan, God. Nung sila, ay.
Okay.
Okay, so also normal. When I conducting a voice whisper test and the tuning fork test, it is normal. And now to examine the neck. So the first to inspection is the symmetry of sternocleidomastoid mass anterior and trapezoid posterior.
Kita na mo ban.
Okay.
Banon mo yun.
Ano?
Aksidente nila. At yung may na. Wala.
Yan mo na,
Yan sa ta-prosit.
And to impalpate the presence of masses and tenderness. Dili ano ba kayo? Bukatan kayo.
Alam ka na, takilid. Ay.
Okay. When I'm checking the neck, it is normal. The next is to examine the lungs and thorax. The first is the chest anterior. So inspect the respiratory pattern. Then inspect also the shape of the patient chest, then colors.
ko dito eh. Ang bata niya, ako na kayo. Ang ka nakatubuan. Oh, doon.
Kasi nagkuhan na si Ma.
Suwan
Okay.
niya man.
Then palpate the respiratory execution, then the tenderness.
Ang baga-baga na nila gatas. Eh, may ito yung anak ko mga sa Manila. Iyahalang padalhan ng pampalit ng gatas. Wala yung anak.
And next is to forecast the different sound.
Yan ang padalhan ng gatas. Ako yung pagtrabaho ba na? Kasi anak ng panganay niya. Kay, ang anak ko kambal.
Now, auscultate the two breath sound. Auscultate.
Wala na, tulog na to. Di na siya na anak. Bata pa na.
Masigi ko, di.
Wala po. Yan na, nagtambal mo sa ginom sa tambal. Ang gawa ng, ginom sa doktor ng pag-ultrasound minsan niya habang matres niya si 106.
Okay. The next one is to examine the lungs. So, auscultate the breaths and sound, the trachea, the spines, and the bronchi. The first to auscultate is the trachea.
Bukan sa menopause, 40 na kapin eh.
Now,
Maabutan na siya.
spines.
Dako ko ng bayi. Kaya anak. Yan nagkuhan ng bata.
Now, okay. When I examine the chest anteriors in the lungs is normal.